my little spiel that I wanted to follow up on. So we're going to turn it over to the legal aspects. And as I mentioned a couple of times, these folks could be your mentor. So Kathy Zeisel is a senior supervising attorney at Children's Law Center. She does work with Candace and other doctors through our medical legal partnership. We're going to explain a little bit more about what that is. Evan Cass is a senior attorney who also mentors on these cases and handles them as well. So when you go to your training evaluation, we just have a section on the medical aspects for Dr. Dawes. And then we have different chunks that we're going to move through in this section. So we're going to get into housing in DC. We're going to talk a little bit more about client realities, cultural humility, thinking about working with the population that we're serving. So acronyms are coming, and they're all in your notes, so don't forget. Okay.
Evan and I are going to awkwardly share the podium so we can both talk to you. I am normally someone who walks around while I train, so you're going to see me wiggle up here. Sorry for that. We usually introduce people, but that'll be really boring for people watching the video. So I did look at who's here, and I'm happy to introduce and talk to you at the end. I'm going to start by talking about what a medical legal partnership is, because you've heard me refer to that really briefly. So medical legal partnership was actually an idea born on the pediatrician side in Boston Children's Hospital. There was a team of pediatricians realizing that they were doing everything they could to treat children, and they were not getting better because there were actually things that were not medical needs preventing the children from getting better. It was legal needs getting in their way. It was insurance not approving things. It was housing conditions preventing kids from getting better. It was things kids were not getting in schools that were keeping them out of schools, things that lawyers could fix. And they said, we need a lawyer on the treatment team. So medical legal partnerships were born. And the idea is that a lawyer is actually embedded into the medical setting, providing legal services to patient families. Children's Law Center was actually one of the first medical legal partnerships in the country. We started in 2001 with Children's National, and we've now grown to be in several settings. We're partnered with Children's National at the main hospital with their Generations, their teen parenting program, which Evan leads our partnership there. We're at the Anacostia Health Center by the big chair where I am. We also partner, we take referrals across the children's system. We're also partnered with Unity Healthcare at their Upper Cardozo Center by the Target on 14th Street, which is one of the largest healthcare centers in the city, and on Minnesota Avenue, and with Mary Center for Maternal and Child Health, which is a federally qualified health center that serves basically almost an entirely immigrant population. So we serve a lot of different populations within DC. Two of our health centers, you could go in and not hear English spoken the entire time you're there ever. And some of our health centers are in our high poverty, largely African-American centers of DC. So we serve a lot of different populations in DC, but all pediatric and a number of different legal issues. Our referrals largely come from pediatricians and other medical providers in the healthcare setting. Sometimes it's actually from the front desk staff, other people who see legal issues coming across their way from patient families. If we're in the health center, we'll do the intake with the family right there. What's great about being in a medical legal partnership is, you guys, sometimes people don't like lawyers. I know that's really shocking to all of us who are lawyers, but they do like their doctors. That lets us get about 10 meetings further in with the family. So they're already having their trusted pediatricians say, this person is somebody you can trust. This is somebody who will help you solve this problem that you have been trying to solve for a long time for your child. And even if you don't like lawyers, just give it a try. So it lets us have this relationship where they already want to give us a try, even if they've had bad experiences with lawyers before, or they just don't like lawyers, or they think it might not be worth their time, right? So it lets us have an in that lets us sort of wiggle in and kind of gives us a way to try to convince them that give us a try. And often it lets us get a good start. And also, I don't know if you've ever tried to call a doctor to get a letter or anything. It can be really hard. But when you're on site, we can get that, right? So it lets us also get the medical support we need for our cases. Those letters to support a reasonable accommodation. The letters to say that this asthma is really bad. This child really does need to be moved. That you really can't just come in with that spray and spray all over the apartment. That's not a good, safe way to get rid of the mice or the roaches or the bed bugs. So all in all, it's a great way to practice law. It's not what I did before I came to CLC, but I've really enjoyed it. So there's about 300 medical legal partnerships. This is where they are across the country right now. basically already talked about this one, but here we are, medical. And there's a lot of legal issues, education, housing, and homelessness. I'm going to kind of go through this slide. The ones you see in red are the ones that we primarily work in our medical legal partnership. So disability, education, housing and homelessness, and health insurance are the ones, and we primarily work in them because that's what the community primarily brings to us. So those are the primary areas of referral over the years that the community doctors and community members have identified as what they most need, where the biggest gaps in other legal services are, and where they see as being some of the biggest health harming legal needs. In terms of outcomes, we not only do work where we provide the direct legal services, but we do a lot of systemic work where we try to change policies based on what we see. We do a lot of policy work in the housing area. We're happy to talk to you more about that another time. We also do a lot of training of the doctors. How does Candace know what housing questions to ask? Because we do a lot of training of our partners about what the law says that landlords have to do and have to provide, what reasonable accommodations are, why they have to remove the carpet if the kid has asthma. That asthma can be a disability. How the landlord letter that they give, we drafted that and gave it to the doctors, right? So different levels of how to engage people and think about it. We do lobby trainings for parents to let parents know what their rights are, so that even if they're not ready to work with us, they start to understand how to document things and how to develop their rights. Here's our medical partners. And in FY 2018, our medical legal partnership worked with over 3,000 children and families. 57% of the children and families we worked with were from wards 7 and 8. So the vast majority of kids we worked with are from those high poverty areas of DC. And in FY 2018, we trained almost 2,000 people through our medical legal partnership. So that's through pro bono trainings like this, but also through clinical partner trainings of our medical partners, conferences, parents, lots of different avenues. Why should you take a housing conditions case? I think we've talked about that a lot, but we have a relatively small staff and there's a really big need. We get endless cases that are called in. We can't possibly meet the need and we need you guys to help meet that need. It's also a really interesting, discrete case for you guys to take, right? It is a really meaningful, direct way to help you. CLC is actually really lucky to help people, not just help you, sorry, help people. We are really lucky. We have a research team on board. And one of the interesting things our research team is showing is that in our housing conditions cases for kids with asthma, we're showing that we actually are decreasing their utilization of the emergency room and hospitalization after we fix their housing conditions. They are going to the hospital less. They are going to the ER less in the 2 years after we fix their housing conditions. So it's really interesting. We're able to show that this work makes a difference, both anecdotally, the families tell us that, but also through the research that we're doing. You get some litigation experience, but you don't have to be a litigator to do it. You're not going to have it's not going to be a big trial. So you get to go to court often, but it's not a huge, massive trial. You get to work directly with a family and you get really concrete results working with those families. I'm going to turn it over to Evan.